I knew I loved science. That was my baseline. It was healthcare. And I was not directly involved with the patient, but we had a huge impact on the patient.
I started as a first-generation college student. I went in undecided, but I knew that I wanted to do something in science and in healthcare. We are the largest university-based program in New Jersey, and we're also the most withstanding program.
This program gives you a deep understanding of the lab tests and how it affects patient care.
We have over 30 clinical affiliates throughout New Jersey.
We have clinical sites all over, so we're not limited in the location of your clinical site. In week 2, we start our lab, which is all hands-on training.
So we usually have lecture in the morning where we talk about the lab testing, how it's associated with patient care, and then in the afternoon we take the students to the lab and we have hands-on practice with the students
We give them that foundation, we give them the background.
so that when they do enter into their clinical rotations, they already have that strong foundation and those lab skills.
We don't want them to have any surprises when they go into the clinical rotation. They get my cell phone number day one.
We offer advisement one-on-one. You're really in a smaller class size and you go through the program with the same cohort.
And we're always available for our students.
And usually they're hired at those sites, and so they have the opportunity to, practice before being offered that job.
A lot of them have told me already that they're being offered per diem positions to work, or they're already being or asked for a resume before they even leave.
It really is a stepping stone towards a career rather than just a single job. If you want to be part of the healthcare team and have direct impact on patient care, but maybe you don't want to have direct patient contact, this is the perfect field for that.